morning everyone and welcome to the third day of Festival Kolaborasi Jakarta. I'm Nasruddin. I'll be guiding you through conducted by several esteemed national and international experts from various fields. And afterwards, there also will be an international plenary discussion with keynote speaker, the Governor of DKI Jakarta, Mr. Anies Rashid Baswedan. Ladies and gentlemen, Jakarta Collaboration Festival 2021 is broadcasted live from CNN Indonesia, Jakarta, and can be accessed directly via cnnindonesia.com, YouTube CNN Indonesia, and also YouTube from the official provincial government of DKI Jakarta. And ladies and gentlemen, the COVID-19 pandemic has clearly demonstrated the need to integrate public health considerations into urban resilience efforts. With its broad spectrum of the impacts, different types of resilience are needed, which resilience related to health can be created through strengthening the overall public health system, enabling environmental conditions to enable people to lead healthy lives during and after disasters and emergencies. But before we start our first policy discussion for today, please allow me to give you a little glimpse on building a healthier and more resilient city.
A healthy city is a city whose citizens practice a healthy lifestyle. Genuinely healthy is the preventive efforts against disease. Nowadays, during COVID-19 pandemic, applying a healthy lifestyle has become very important. There are different ways to achieve this, among others by doing routine physical activities, maintaining a balanced diet, and managing stress. Governor of DKI Jakarta, Anies Rashid Baswedan, frequently urged Jakarta citizens to implement healthy living patterns. Implementations of healthy living patterns can be done by exercising, consuming fruits on daily basis, and getting adequate amount of sleep. Health is also a supporting factor in improving the Human Development Index. For this, the government of the DKI Jakarta has provided several programs to improve healthy service to the community. One of the programs offered free health service facilities for Jakarta citizens. From emergency ambulance service, physical health examinations such as X-ray, laboratory tests, and electrocardiography. To maintain health, balanced diet is also important. It begins with meal planning by considering the nutritional quality of the food and creating weekly menu. It is also essential to refrain from consuming instant or preserved food. Living stress-free is also important for health. Therefore, we must think positive and have enough sleep. Additionally, having a winning mindset and willingness to live a long life also contribute to a stress-free life. With a healthy lifestyle, risk of non-infectious disease such as stroke, coronary heart disease, cancer, and other disease can be minimized.
Yeah, that was several types and also tips to build how to build a more resilient city. And ladies and gentlemen, to lead this discussion for today, we have Dr. Zulvia Oktanida Syarif, a psychiatrist from Tarakan Hospital, Jakarta. Dr. Zulvia, or Miss Fifi Syarif, will be our moderator for our first discussion for today. Good morning, Miss Fifi. How are you?
Good morning, Fanny. I'm great. How are you?
I'm good. Thank you for asking. Are you excited for today?
Super excited.
Of course, we all do. So therefore, without any further ado, this time and discussion, we do really hope we get a lot of insightful views from this discussion. Yes. The floor is yours, Miss.
Thank you so much, Fanny. Good morning, ladies and gentlemen. It's an honor to have you all with us today. Let me introduce our speakers. First, we have Mr. Nasruddin Djoko Surjono, the head of Regional Development Planning Board, Jakarta Capital City Government. And Mr. Nasruddin will help us to know more about cross-sectoral and collaborative approaches towards promotive and preventive public health services in Jakarta. And joining us via Zoom, we have Mr. Pandu Riono. Mr. Pandu currently works at the Faculty of Public Health, University of Indonesia. He does research in statistics, epidemiology, and infectious diseases, also epidemic modeling. His current project is tuberculosis, HIV, COVID-19. And also we have Dr. N. Paranietharan, WHO representative in Indonesia. His notable achievements is in health systems strengthening, health sector coordination, and technical assistance to governments and development partners. Before joining in the WHO Indonesia office, Dr. Parani was the WHO representative to Bangladesh, and Dr. Parani joined WHO in the South Sudan and Somalia offices in 2005. And I will give the first opportunity to Mr. Nasruddin Djoko Surjono to talk about our topic, building a healthier and more resilient city. Good morning, Mr. Djoko.
Morning, Dr.
Morning.
Vivi. Morning.
Please, the time is yours.
Thank you, Moderator, Dr. Vivi. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon us. Good morning to all audience. Distinguished resource person, Dr. Parani Saran from WHO, representative in Indonesia, Dr. Pandu Riono from University of Indonesia. I would like to thank for this opportunity to convey presentation regarding the importance of improving urban health in Jakarta and relation between city and health as urban planner perspective. Cities can represent diverse conditions within which people live and represent a range of human experience. Cities also affect health. There are three broad categories that explain how city living can affect health: the physical environment, the social environment, and availability of and access to health and social services. Rapid urbanization in megacities such as Jakarta has been giving impact in wide range of urban problems in last few decades. The imbalance between population, growth rate, and urban resources lead to decrease in the quality of urban services. Jakarta also has environmental challenges such as floods and land subsidence. Jakarta citizen lifestyle has also been contributing to health issues such as communicable disease or non-communicable diseases, violence and injury, disaster risk related to climate change, and mental health. The decline of the quality of urban service result in a high vulnerable of the population to diseases that originate from pressure or stress and shock, that especially during and after the COVID-19 pandemic. Alhamdulillah, we have successfully developed Jakarta Public Health System Framework and Strategy by involving local government agency, private sector, NGOs, experts, academia, and citizens, which is written on white paper that is expected to be one of reference for policymakers in Jakarta and other cities. This is the cover of the white paper of urban health in Jakarta. Thank you. We define also Jakarta urban public health as a comprehensive health system development by optimizing city resources management to improve the quality and sustainability of urban services and to ensure better health for the people. Considering Jakarta urban public health determinant consists of infrastructure, environment determinants, social determinant, economic determinant, and also government determinant. Jakarta has initiative to improve the people's health and well-being as follows: by fulfilling people's basic needs, by improving kampung facilities and providing clean water and sanitation, promoting active mobility by providing bike facility, protecting the air quality and the environment and open green spaces, providing health community base. And we formulate 15 general strategies to strengthen Jakarta urban public health that involve health in policy from housing, safe water and sanitation, public transportation in health and nutritious food, infrastructures for physical activity, mental health facility, and promoting child-friendly city, waste reduction, financing, and investment opportunity, sustainable urban development health facility, and also digital transformation, disaster risk management, general strategy as a result of SWOT analysis. The local government agency of Jakarta province become internal scope to identify the strength and weakness. The other element of the pentahelix that consists of business, community, academia, and media become the external scope to identify the opportunity and threat. Furthermore, we classify Jakarta urban public health strategy into two parts. There are direct and indirect strategy. There are direct strategy related to the health sector and indirect strategy related to other sectors that support urban public health. Several investment opportunities in urban health have been identified based on the determinant of urban health, on the determinant of the built environment and infrastructure, green infrastructure, such as green roof, garden, and permeable pavement, electric bus, intermediate treatment facility, medical waste treatment, as well as wastewater treatment plant become the investment opportunity. The investment opportunity in the provision of telemedicine and technology for business model, innovation, health sector become the opportunity in the government and economic determinant, internal of social determinant. Investing in early childhood health in Jakarta will complement investment in education, building up a generation of adults who can fill the growing need Jakarta's evolving labor market. We are very welcome for the collaborator to create healthier, fair, and more resilient Jakarta. This slide shows a pilot project initiative that can be implemented in Jakarta in order to strengthen urban health system. There are the comprehensive plan of urban revitalization that aim to improve the quality of settlement and citizen life, including access and equity to safe water, sanitation, and public facilities, such as health care facilities, education facility, transportation, and green space. Implementation, the health promoting school to strengthen its capacity as healthy setting for living, learning, and working by fulfilling the global standard from health promoting school. The public health is one of the important factors in determining whether we are providing a favorable environment for people to live in. Thus, we need broaden our perspective by conducting collaborative action, learning from Jakarta experience. It is critical to build synergy and create collaborative action in redefining the public health system. All the collective action are needed to be implemented jointly with citizen, private sectors, and all entities as co-creators. Since the health issue lies not solely in the hand of government and health worker, as a livable city is a basic right for all. I would like you to invite to participate in a collective movement toward making the city of Jakarta healthier and more resilient for everyone in it. Our concern is a safe life for everyone in Jakarta. Protecting Jakarta is protecting Indonesia, which is number 4 population in the world. Protecting Indonesia is protecting the world. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Mr. Djoko, for your presentation. So, ladies and gentlemen, as we can see from Mr. Djoko's presentation, that the Jakarta provincial government has done various strategies to promote and improve urban public health in Jakarta City. We will talk more about that in the discussion session later, but I will proceed to our second speaker, Our second speaker is Mr. Pandu Riono, Epidemiologist, lecturer at Faculty of Public Health, University of Indonesia. Good morning, Mr. Pandu. Good morning.
Good morning.
Morning, how are you this morning, Mr. Pandu?
Okay, I'm fine and healthy.
Yes.
Healthy lifestyle.
That's great. Great to hear that. All right, Mr. Pandu, we are going to discuss several things, and I have several questions to ask you. The first one is, are people's quality of life influenced by urban patterns and flows? What do you think?
Okay, Jakarta is, I was born in Jakarta, and I have dream in Jakarta someday become the most livable city. It means the quality of life people who living in Jakarta become better and happy, not only healthy but also well-being. This is important because sometimes we consider health is not associated without the disease. Actually, also happiness is also important. And Jakarta, when you see, or any urban city in the world, is inherently, they have many problems. The biggest problem is the patterns of urbanizations. We can see in Jakarta, the two main reasons is density populations. And then we also look at in the household level about the crowding. The crowding is important too. It means that inherently some area, not all area in Jakarta, is consists of the problem of density and also the crowding. And this is influence about the how we are living, about the quality of life. Because if you stay in the density, you have another problem with the air quality and also water and ventilations. And like in COVID, you know, we need more, I mean, the ventilation is better to remove or to make sure that the flowing of air is reducing the risk for transmission. And the third is about the pollutions. Pollution come from the traffic, from the factory, can also pollution that made by people. Smoking behavior. Smoking behavior is pollutions in the household because many people in Jakarta, especially Indonesia and also in Jakarta, smoking behavior also influence the quality of life because we produce the pollutant in the city. That's why the quality, even we have green space, but the quality, if we can reduce and make space of living, it means that reducing the density and also reducing the crowded is making life is become better.
Yes. So it seems that there are so many aspects related to public health concerns in Jakarta. And I would like to go to the next question. Oh, by the way, I'm glad that you mentioned happiness. So that's something that we need to focus on, the happiness of the Jakarta citizens. That's let's not forget about that. Right? Okay.
Important is mental health.
Yes.
Happiness and mental health.
Yes, happiness, mental health, and well-being. Mr. Pandu, I have the second question for you. What are the spatial planning conditions of a determined neighborhood that could determine a healthy local environment?
Yeah, I mean the spatial is because Jakarta, we have Jakarta, we have factory, we have housing, we have market, open market, or wet market. It means that it seems that there's no regulation or there's no planning about how to accommodate about the spatial because house should be in somewhere, allocated in somewhere, not not near the river, something like. Because if you put the house in the river, maybe when the flooding of the river, or sometime it's become flooding also come to our condition in the house. It means that because when I was kid, I was stay in West Jakarta, every year is always flooding. It means that when I was small, I'm happy because I can play with the water. But when I become grow up, I cannot happy anymore about the flooding. It seems that the spatial is important because sometimes people cannot stay in the cannot remove the conditions because the environmental we are living in the near the river or maybe near about the street in tall area, because there will be also the traffic, the combustions also become affect our health, and maybe near the factory. This is important to rearrange the where located the house and located in the market. The important is to be in one unit community. I cannot if market or I work far away from my house. It means that I need also the transportations. The transportation also problem because previously we are using the bad public transportations. Now become better because public transportations become better. But it means that we still need time to go to somewhere and reducing the traffic, and it's very difficult. You know, if I want to using bicycle, I cannot using in the previous day, maybe 3 years or 4 years ago, because there's no lane for special bicycle, something like that. It means that we should rearrange about how we are living, how we are moving, how we are getting together. We need also like what we call is green space, maybe open area for exercise. Not currently we are exercise in the street in the weekend. It's not good because we need exercise also during the day. If we can exercise, is also reducing the NCD. NCD is non-communicable diseases, and also influence our happiness.
Yes, so I believe that the spatial planning condition is a very important aspect related to the public health or the health aspects in Jakarta. And so spatial planning condition might be the homework for Mr. Djoko and the Jakarta provincial government to provide us with good spatial conditions related to our health, mentally and also physically. And in this event, we're talking about collaboration, the Jakarta Collaboration Festival. So my third question for Mr. Pandu, how to build the citizen awareness? We need the citizen to collaborate with us. How to build the citizen awareness to promote urban public health?
Okay, this is very good that you ask about the community involvement, because many city forgot about the importance of the role of community to give some input or donate something, or because when you educate the people, like educate to about how you walk, how you using public transportations, and also how to caring of your children, because children can also play in the street, especially in the small street, in the gang. We call it gang and kampung. It means that this is important to have info from the people, because people by daily they know the problem, and if they depend on the solutions come from the governments, it takes time. It means that governments and also people or community should have some getting together. Okay, what's problem in your area? Because in different area have different problem. There's no one solution for all problems, because the problem also different in the North Jakarta and also problem about in the West Jakarta, because the situation is different. And if also governments trying to rehab or make developments without asking participations or permissions to the community, you can become failure, because they will, like if you are maintaining the small street using pengaspalan, you know, the waving for the walking area. Sometimes they don't care about the cleanliness. They don't care about the cleanliness. They need somebody from government take care of and everybody clean. It's not good. It means that we have job to make sure and everybody have some contributions. Not only governments, but the people who live in that area is important to be asking and also have some responsibility to take care of their environments.
Yes, so the point is community involvement. So Jakarta citizens, wherever you are watching this show this morning, we need your participation to make Jakarta a better city. Thank you so much, Mr. Pandu. It's a very insightful talk.
Thank you.
We will discuss later in the discussion session. And I will proceed to our third speaker, Dr. N. Paranietharan, WHO representative to Indonesia. Good morning, Dr. Parani.
Selamat pagi, Ibu. Good morning to your audience
Selamat
as
pagi.
well. How are you, Ibu?
Yes, Dr. Parani, you have time for giving your presentation. The time is yours.
Terima kasih, Madam Moderator, Dr. Zulvia. And I'm happy to be with such an excellent panel with Djoko from the Jakarta government and Professor Pandu Riono. Let me pull my slides and start looking at it. I think quite a lot has already been discussed by my fellow esteemed panelists. Now, what is important is, I think already we have discussed why health and resilience is important for urban cities, clearly explained by both panelists. I would like to mention a few other dimensions in terms of urban health inequities. The real challenge is we have done a global report and looked at more than 100 countries, including Indonesia. And what we have seen is that if you have, say, 100 households in a city, in terms of wealth, the richest 20 households always do better, whether it's health or access to piped water or children under 5 and their survival rate. So clearly there are urban inequities that are extremely important today when we talk about health and resilience in cities. On the other hand, these inequities are not unique only to Indonesia. These inequities happen whether you are the richest country in the world, you are a high-income country, or you are a middle-income country like Indonesia, or a low-income country. We have seen these inequities worsening with the COVID pandemic across the world. We have data from UK showing that let's go to the slide further down, please. Okay. So this slide, basically, this is a global report I was referring to, about 100 countries, and the richest households are 2.7 times more to have access to piped water. and children under 5 in an urban household, the richest household have a better survival chance than a poorer household. Next slide, please. In this slide, I'm showing the effect of COVID pandemic, and this is in England. So the reason I brought England is just to get an idea that urban health inequities is not a unique problem to only a set of countries or developing countries. It's a problem across the world. High income, middle income, low income countries all are affected. The poorest of the poor in, say, Jakarta or Indonesia may be affected differently than the poorest of the poor in England, but they are, in compared to the richer people in the same urban setting or in the city, they are affected more. And that's why we need more equitable cities to address these issues. So let's look at the next slide and see how we should look forward to health and resilience in urban settings. I'm very happy that this is already covered in Jakarta's plan, and I think Djoko covered it very well, and further the community engagement and other aspects have been explained by Prof. Pandu Riono as well. So Jakarta is doing very well on this. I also have to congratulate Jakarta for the excellent job they are doing with the COVID vaccination, particularly the coverage of COVID vaccination for people over 60 years is more than 90% in Jakarta, the highest in any province in Indonesia. And probably Jakarta is the only province that has more than 80% coverage for this age group. And that clearly shows as a proxy indicator how well Jakarta is doing on the pandemic. So kudos and our salute to the leadership in Jakarta and all the workers, from health workers and all the workers even up to kampung level of the Jakarta government. Excellent job. Thank you. Terima kasih. Let's look at the next slide, please. Now, when we talk about equitable city and healthy and sustainable city, under Sustainable Development Goals, sustainable cities and communities is an important goal for UN and the world as all the member states. And by 2030, we look forward to achieve significant improvements in these areas. And for us, just on 12th this month, we had the Universal Health Coverage Day. And basically, the universal health coverage is important, and healthy cities are the most important for universal health coverage as well. Let's now look at Jakarta in the next slide, a few pictures, and look at Jakarta. And it's not about whether Jakarta is the best city in Indonesia, but now that Jakarta has done very well, as already we have seen in the presentation, how can we get, as Prof. Pandu said, make Jakarta into like Indonesia, into Singapore, or Seoul in South Korea, or Tokyo in Japan? That's our goal. So quality is about doing it right. Jakarta has done a good job in having more than 240 kilometers of sidewalks. So on your left, you see a picture. On an anecdotal, in some areas on the sidewalk, we still have these holes and it's not very safe for people to walk. So it's important to improve that. So that's how we can be like Singapore or Tokyo of Japan. So we need to give much more safe environment for walking, and I think Prof. Pandu already covered the cycling. I think that's a great initiative, and we need to expand this more so people have more healthy lifestyle. On the middle, you may know this is the Sundays, the car-free days. I really love it in Jakarta to be able to, go out without a vehicle and walk around and all of that. Now, one improvement is, I think it's fantastic everybody's going out, is that when we look at the food stalls there, we could probably increase the options of food into more healthier food and publish the content of the food in terms of what is a diet and what is a value. And maybe educate these vendors on to make more traditional and healthier food option. There's quite a number of them available. But as we know, we all have a weakness to goreng, whether it's nasi goreng or ayam goreng. And at the same time, that oil is not healthy. As I grow older, I realize that my body is not welcoming a lot of oil. And so it's important to have much healthier and affordable options available. The same for Jakarta Marathon. I think I participated in the 2019 marathon, not the full marathon, but only the 5 kilometer. And I did enjoy that. But now that we are in a pandemic, we don't have this marathon as a physical event. Maybe we have to use the digital transformation, the technology mentioned by earlier speakers, to see if we can bring something like 10,000 steps a day contest and have contests kampung by kampung and local area by local area across Indonesia and across Jakarta, and maybe do it for 100 days. Because what happened to this marathon, and I'm sharing personal experience, I prepared for a month and I managed to complete my 5 kilometer. I was very happy, and then I dropped it. But if the competition goes for 100 days and somebody monitor me on a mobile app on a daily basis, I will be doing more exercise over a longer period. And that way, that will become a practice and part of me. So these are some potential improvements that we can make. And one last one, I think in the presentation, it was covered very well as well, is in the next slide, the disability inclusive development. I think Jakarta on the sideways have a proper way for people who are visually impaired to be able to walk. But I think we need to do more in the building codes, especially I have the Jakarta planner here, for all the new buildings to make it more accessible for people who have a disability. And I'm telling this from our personal experience in my own office in Rasuna in Kuningan. We had actually a presenter who is visually impaired making a presentation to us, and what are his challenges and how we can accommodate. And we just realized my office, from the security point to the card and going into the lift, there's no voice recorded messages. So it's almost impossible for a visually impaired person to walk into even WHO office in Jakarta. And we are now trying to talk to our building management and see how we can improve this. And likewise, more work opportunities and also different learning opportunities as part of health promoting schools and others, but beyond that, particularly for people with disabilities, because the goal is we don't want to leave anybody behind. And this group of people may be left behind if we do not do more. And Jakarta is already doing a fantastic job on this. It's only a matter of making it more and also involve the communities and people to understand the needs for this group of people. With that, my last slide, I can't leave a presentation without mentioning about COVID-19. It's important that we continue to protect ourselves and help others by maintaining physical distancing, clean our hands frequently, wearing masks, and first of all, like people in Jakarta who have done a very good job by getting the vaccination dose. Thank you very much. Terima kasih, Ibu. Over to you.
Thank you very much, Dr. Parani, for giving us the external perspectives to Jakarta. So we can see how the WHO appreciates and notices some of the improvements that the Jakarta city has already achieved. Well, we are going to continue to our Q&A sessions. Here we have several questions from the audience, and I will try to ask this question and ask the speaker to answer the question. We have a question. I think this one is for Mr. Djoko. Okay, Mr. Djoko, what will Jakarta do to initiate the implementation of urban health?
Okay, that is a good question. Actually, we start from some pilot project initiative that can be implemented in Jakarta in order to strengthen urban health system. There are first the comprehensive plans of urban revitalization that aim to improve the quality of settlements and citizen life, including access and equity to safe water, sanitation, and public facilities such as healthcare facility, educational facility, public transportation, and green space. Secondly, we have to implement the health promoting school to strengthen its capacity as healthy setting for living, learning, and working by fulfilling the global standard from health promoting school. Besides that, the strengthened urban health system in Jakarta, we will continue the strategic project that has been done in 2021 to improve urban public health in Jakarta.
Thank you, Mr. Djoko, for the answer. So I think there are challenges to implement this urban health. So I would like to ask Mr. Pandu Riono, what is the big challenge to implement the urban public health in Jakarta?
The big challenge is political will. If the leader not only the leader in Jakarta, but also the leader in the city, because Jakarta is a big city and small city, and also the leader, the informal leader, they have some political will to make Jakarta is better living conditions, and make sure that we are all happy and we are contribute for making this happen. Because we cannot waiting. If we wait, another problem will come, because every day Jakarta is, during the day and during the night, we have different number of people. And also demographic structure also influence. Like if we have some area, this many old people more than 60 years maybe need more attentions about their conditions. And this is important because if everybody not working together or make collaborations, urban health is never happens. It should be making our dream. Everybody who living in Jakarta have the same dream, how make Jakarta in better life, healthy life, and also happiness is our goal. Because without that, we don't have any purpose or any motivations during to make it happen.
Yes, so we need a good political will and also collaboration from all stakeholders to implement the urban health in Jakarta. The one thing that we are really hoping for. All right, I'm going to continue to the third question. I think this one is for Dr. Parani from WHO. Recently, we hear more and more news about bullying, substance abuse, and obesity among school-aged children. Do inequities have a role in those cases? And what can we do to address and prevent such problems? Dr. Parani.
Thank you, Ibu. And I think this also touched close to your specialty. You may have seen a lot of these children, hopefully, in your practice as well. So you're as good as an expert as I am on this. Now, we have looked at a systemic review in more than 55 various research papers that are clearly identifying that the children from socio-economic disadvantage or poorest quintiles have a 2 to 3 times higher chance of facing more bullying or other mental health issues or substance abuse than others. Now, so if we want to address this, because 90% of the children in Indonesia and in Jakarta are school going, I think school is the major location, and then we may need special initiative for children who are not in school. But we can at least cover 90% of the children in school and make sure schools are free of bullying, and school have not just a positive learning environment, but also a thriving environment for overall early childhood development. I'm very happy that Jakarta is adapting and is already adapted and scaling up the health promoting schools approach. And this address just beyond the learning and broader issues. And at the same time, this is something we work in partnership with a number of other agencies and others. Now, when we talk about school, the first thing now we have is in the pandemic, schools are either, all online, or we are only, people are coming into school for only a day. And we do strongly recommend the schools to open fully for children. We can get the vaccination now. It is available for everybody over 5 slowly in Jakarta as well, and to get kids to school full time. And a humble request to all the teachers and the educators to look at their role beyond just teaching a subject, to look at their role and an important role they play in shaping up the future of the child. The future of the country lies actually in the hands of the teachers and the educators, beyond the parents. And that's an important role. A third one, when we talk about substance abuse, something that is a bit disappointing to us as World Health Organization is, if you look at the smoking and use of tobacco in the schools, in the school-age children in Indonesia, that is one of the highest compared to other countries in the world. We need to strictly ban the advertisement of any tobacco products in Indonesia through any medium. And that's extremely important, and we need strong government and stakeholder action including parents and teachers. Not only they try to quit smoking, but not to encourage or allow children to learn smoking. Quite a significant proportion of school-age children in Indonesia use tobacco. And that's a major one. And then that leads to other substance abusers and others. And this is a weakness of Indonesia, and this is going to keep Indonesia or hold back Indonesia from growing into a totally developed country if we do not address it right now. So that's a humble request to everybody to do that, to make sure that this is addressed as an urgent priority, and Indonesia brings stricter measures against the use of tobacco and substance abuse. That's our humble request. Terima kasih.
Terima kasih, Dr. Parani, for the answers. Since this is a very important topic, bullying, substance abuse, you mentioned about tobacco or smoking, and also obesity among school-aged children. I would like to welcome other speakers. Probably you have your own perspective on this. Maybe Mr. Pandu or Mr. Djoko. Mr. Pandu, do you have any opinion about this substance abuse, bullying?
Okay, this is related with how the kid play and how to keep the kid after school playing or educations outside school, because what's happened in the family, and they will bring the behavior in the family in the school, and also behavior in the school can also influence the behavior in the family. This is important. And another thing is about the regulations. We know that every corner in Jakarta we have small toko or mart, yeah, something like that. We should regulate that they cannot sell tobacco. I mean, it means that only tobacco in the big mart, not in the small mart. If we can prevent the accessibility about the tobacco and make sure that it should be regulation is also cannot buy any underage, something like that. Is school children cannot buy the tobacco. Is important to be implemented in Jakarta, because without that we are still in the developing country, like in the city, we can buy only one cigarette. It means that it's cheaper in one cigarette. Even in one box is very expensive. But it means that they cannot buy only one cigarette. It should be one box, something like that. This become very difficult children to get access about the smoking. And the third is about the social determinants, not social, the commercial determinants on any food products, because any food product, the contents maybe is very high in the sugar or in the salt, something like that. This can be regulated. Under governments, should be under the quantity and the contents is should be safe consumed by the children, because without that is become very difficult, because become habit and people consume it every day, and then obesity can become problem, and also another problem like hypertension, and also in the future will become heart disease.
Yes, thank you so much, Mr. Pandu Riono, for the insights. So family strengthening and also regulation is very important. Well, I would love to discuss more about this, but because of the time limitations, I'm afraid we have to end our discussion session. So, gentlemen, I am very grateful for having you here with us today, Mr. Djoko. Thank you so much. Mr. Pandu Riono, and also Dr. Parani. Thank you very much for the great talk and presentations. And thank you so much, all speakers. And that's wrap up our policy discussion today. And now I will give the show back to our host, Farhanisa Nasution. Thank you and good morning.
Well, thank you, Ms. Vivi. Certainly that was an insightful discussion on how to build a healthier and more resilient city. So that be sure that Jakarta is ready for that, right?
Yes, let's make sure together.